Namaste. Thank you so much for coming today to engage in some massage therapy. I'm so honored to be teaching this because it has helped me throughout my pregnancies. And you know, everybody has aches and pains some way or another. So this is a wonderful way to massage your body and just get in alignment with yourself. So let's get to it. So we're going to start with the calves, and if you have a book or a block or whatever that can elevate your foot a little bit, please start like this with one knee bent and one leg flexed, and you're gonna lean forward, and the ball's gonna massage, and you can adjust as you go depending on your tightness, depending on your range of movement, whatever works. And if this is too straining in your wrist joints, you can just choose to be here and just move the leg, or manually adjust the foot with your hands so that you can get this area massaged. So here we go. We're just going to stay here for another minute. You can point and flex the foot as you go forward and back to engage the muscles. And you're breathing. And this is not easy. A lot of people are tight, especially runners and people who use their calves all the time by standing. Okay, let's do the other side. So shifting the block in the Yogatina Falls, bending one knee, having your hands behind you a little bit, chest is open, and let's lift the butt as you point, flex, point, flex, point, flex, point, flex. One side is always a little tighter, so you could just breathe through it. And if you find a spot that feels a little tight, stay there, circle the foot and ankle. This is called pinning and stretching. So you could just let the sustained compression of the gravity pull your leg down as the balls pinpoint at that region. We can even go further down towards the attachment of the ankle and the calf, and just get in there. Getting some circulation, some movement, some freedom to walk better, to breathe better, to move better. And let's circle the other way. And let's go to the shin. So the ball is set up the same way, horizontally on top of a block or a book. And I want you to set yourself up in a nice tabletop and set it up so that your knee is right below and close to, so the balls are close to the edge of the block and the knee is right above the balls. And as you slowly breathe in, you're going to shift your body slightly forward. The balls are going to shift down towards your ankles and back out again as you exhale. Inhale forward, exhale back, inhale forward, exhale back, and just breathe through it. This is also another point that gets really, really tight on some people, depending on what you're going through, what kind of circumstance. If this is too much, back out of it. So you choose your pressure. You can choose how strong you want it. You can lean into it more. You could stay in one spot and breathe. And you can even pin and stretch as you move the ankle and foot in one direction and the other. Good, let's switch. Now the ball can go from your knee all the way to your shin, all the way to the crease of the front of the shin where the foot meets the that's a pretty intense spot. So depending on where you want it, I'm gonna pin and stretch right here. I'm gonna breathe deeply, sigh it out, and then continue to move. And, oh, I just found a spot, so I'm gonna stay in that spot and just do tiny movements as I breathe and move. Good, very nice. So let's move on. Let's bring the ball. So we're going to start by rolling out our IT band. So we're going to come to the side body, placing the forearm down and placing the ball at the gluteus, the side of the gluteus. And then with both hands planted, reaching one leg, the leg that you're working on long and the back leg bent, you're just going to lean up and down and glide the ball and adjust it as you go, depending on, and breathe, because this is pretty intense stuff. Good. And I want to stop right there already. It's not my favorite spot. I don't think it is for a lot of people. So you can take your time, pause the video, keep going with it until you feel satisfied. You can start small and then go long, depending on how you feel today. No matter what, the IT band gets pretty tight because we use our legs a lot throughout the day. And so here we go. That's that. Let's lay on our backs and continue to massage the gluteal area. So placing the balls vertically and then opening up that right knee. Relax your upper body. Your hands can go wherever you like. And then as you swipe your hips side to side, the ball creases against the entire gluteal region, massaging, getting rid of any tightness within that region. If you found the spot that you prefer to go deeper, you can just stay there and breathe. Let your body weight, let gravity pull you down even more. Relax into that tissue. And then, even more so, you can actually move that leg in a bicycle action. Pin the ball and massage that region. All right, let's do the other side. Open the knee. Allow your hips to move side to side as the balls swipe across that entire gluteal region, massaging, releasing, bringing you with a greater understanding of ease. Tension exiting the room and exiting the body with each exhale. Good. And then I want to move a little bit more so you can even lift and straighten that leg as you lift and lower, lift and lower. Just allowing. So everybody is unique and everyone's going to feel it differently here. I want you to take another 20 seconds to just do whatever feels good to you. Moving into that gluteal region, moving side to side, staying there and breathing, whatever works best. Good. Sigh it out. Breathe deeper. Very nice. Come back with both knees bent and just notice, Take a moment to notice the tingling in your legs, in your hip region. And then again, we're going to start from the area above the hip joint. So the balls nestle horizontally above the block, and you're trying to find that region that's not bony, but the area above the bone, and open the knee out so that the ball nestles right in that divot. And you're just allowing gravity to do the work for you as you breathe. And you can do a pin and tightening and releasing. So tightening that region, squeezing the side obliques, and releasing. Squeeze the side body towards each other and release. Stretch and release. Squeeze and release. Squeeze and release. Good. Let's switch on over to the other side. Opening the knee out, and immediately this side feels a lot more different. So I'm just gonna notice, take note as I breathe through it all. And I'm just gonna stay with sustained compression on this side because I feel that that's what I need right now. That's what I need today. So you're different, your body's different. You can choose to stay here and breathe, or you can do the side crunch and release. Side crunch and release. And all that's doing is that it's creating more blood flow. All the fascia around the muscles are just gently dissolving.